Everyone wants to have a great smile and fresh breath, which is the reason why good oral hygiene is important. Having poor oral hygiene can lead to a variety of dental problems such as tooth decay.
You shall remove these particles between the teeth. There are some parts, for example, after doing this circular motion all over here, you can now open your mouth and you do this type in this form, what you can call vertical one, and you also do this. You don't forget to brush on top here. And another thing we normally forget is brushing the tongue.
Tooth decay is caused by taking too many sugary foods, which attract bacteria, hence damaging the tooth. According to the dental surgeons, change of diet could offer some remedy to the tooth decay problem. Reducing the consumption of sugary foods and drinks, particularly between meals or within an hour of going to bed, could minimize the risk.
Sugar, that is refined sugar. These are chocolates, these are sweets, biscuits. Refined sugar is usually the cause. Though even food which has got carbohydrates in it, once it gets stuck somewhere and you don't remove it, because we have the bacteria in the mouth all the time, so they come and colonize that food. Their products are acidic, then the acid starts burning the tooth slowly, and you get a cavity and more food gets impacted, so you get a vicious cycle. More food, more bacteria, more food, eventually leading to destruction of the tooth.
The study revealed that among adults, we have a prevalence of dental caries, that is tooth decay, at the rate of 93.1%. That means that among all the adults, we have less than 1% that hasn't, less than 7% that hasn't suffered tooth decay.
Teeth are covered in a hard outer coating called enamel, and every day a thin film of bacteria called dental plaque builds up on the teeth, producing acids that can harm the enamel and cause holes in the teeth, often referred to as cavities.
Before you brush your teeth, if you look at your teeth, you'll see a whitish layer covering your teeth. We call that white material or material alba. If you don't brush it off, the bacteria in the mouth start colonizing it and eventually make it stronger to get stuck on the teeth. And once it sticks, that is 3, 4, 5 days, it becomes difficult to remove with a toothbrush. And that's when we call it now plaque. It is harboring a lot of bacteria. The products of bacteria entering the body through the gums, and so you start a vicious cycle.
Today, the cavities can be filled using dental amalgam. However, concerns have been raised about this material because it contains mercury. But Dr. Philip Openshaw, a dental surgeon, says dental amalgam causes no harm.
Well, when someone gets a hole or a cavity, that means that the minerals have been sucked out of the tooth and it gets soft. And when it starts soft, then it starts to dissolve the tooth. So when we do amalgam, we excavate, we remove all the decay, all the soft tooth structure, and then we pack in amalgam. And amalgam will pack in really hard and it seals so moisture can't get under it, in generally speaking.
According to the dental surgeons, flossing or use of other between the teeth cleaning aids is a must because bacteria breeds in such areas.
And when you're brushing your teeth, taking a toothbrush, just making sure that you get a good toothbrush that you're using, and you can pick toothpaste. Colgate is a good brand to use. You can use any other brand. The most important thing is getting one that has fluoride in it. So the fluoride is going to help to strengthen and mineralize your teeth.
Studies from the Ministry of Health indicate that 51% of children below 5 years and adults who constitute to 93.1% suffer from tooth decay, 79.3% suffer tooth losses, and 82.1% suffer from tooth pain. The study shows that 71% of the affected people suffer from gum disease, 13% facial trauma, 3.4% suffer from oral cancer, and 42.9% suffer from bad breath. The statistics also show that 35% of the population have access to dental care and that doctor-patient ratio currently stands at 1 to 1,070,000. The Health Ministry has only 330 registered dental surgeons and receives an equivalent of about 9% of the GDP for financing its budget. Of this, less than 0.1% is allocated for dental health programs.
So when you compute, I'm sure the budget coming straight to oral health will be less than 1% of the total sector budget. So within that 1%, we have to ensure that we do what is required, and that involves supporting the regional referral hospitals, especially visiting them during technical support supervision, and we get to see the needs of the dentists who are working in these hospitals. We report back, and the ministry has the mandate to ensure that what is required is available.
Juliet Nabanja, the head of the Oral Health Department at the Ministry of Health, says the department is faced with numerous challenges, including limited dental health equipment.
The challenge is dental equipment. Dental equipment is very expensive, and 2-3 years ago we got partners from Canada who helped us to furnish regional referral hospitals. They are all equipped with the basic equipment. If we got another partner, I would appreciate to better what we have, but for now we have the starting point.
Dental diseases are majorly suffered by people living in urban areas because of their diet as opposed to those in rural areas. Medics, however, assert that lack of awareness about oral diseases, poor access to adequate dental care, lack of quality dental materials at affordable prices, and insufficient investment in dental care must be addressed immediately. Report by Simon Semazi for Urban TV.